Hello and welcome to Askimo TV. I'm talking today to Dr. Ruben Kannan. Dr. Kannan is a plastic surgeon at the Dr. Chambers Aesthetic Clinic in the UK in London. Hi, Dr. Kannan. How are you?
I'm fine, thank you. Good morning, Joanne.
Dr. Kannan, let's talk today about hair transplants and frequently asked questions that people may have. So, what are the different procedures for hair transplant?
There are different procedures. They can be divided into procedures which remove the bald patches and close the scalp around it. It's called direct excision. Or it can be procedures where we graft hair from areas in your scalp which are rich in hair follicles to areas which are relatively sparse, which is called hair transplants. And hair transplants, we can either use areas of your scalp and just take it from one area as a strip and put it onto the other area, but this leads to a clumpy appearance of the hair. Or a more refined way of doing it is to take the individual follicles one by one, in the thousands perhaps, and individually place them at the right angle into your scalp. And that by far gives you the best results.
If I decide to have a hair transplant, how many sessions would I need?
That depends on your case. In your case, I suppose, as a patient, it depends on what's available around the area, what's the density of hair that you have that we can safely take from the donor side, and also how much is lost. Now, in most patients, they come in with sparse hair, and all you need is in between you try and repopulate that area to make it look denser. So in those patients, perhaps 1 or 2 sessions. And it also depends on how much is actually transplanted at one stage. On an average, we transplant between 500 to 700 hair follicles per session. But if your area is large and sparsely populated, essentially hardly anything, you might be looking at maybe 4 or 5 sessions to get it up to something reasonable. And that process could take months to years.
How long does the transplanted hair last?
It should last forever. The idea of using hair follicles from the back of your scalp are that they are relatively resistant to the hormonal and chemical changes which affect the hair in the front. So technically, provided they have taken and not infected the initial stage, they should last more or less as long as the hair in the back of your scalp lasts, which should be permanent.
If I have a medical condition, can I still receive a hair transplant?
It depends on what kind of medical condition you have. If you have common comorbid conditions like blood pressure, diabetes, you could accept them. However, if you're on steroids, if you have liver problems, kidney problems, or if you're undergoing chemotherapy or radiotherapy, then I wouldn't recommend the procedure. It will not necessarily work in the longer term.
Will the surgery leave any visible traces?
The surgery, the hair that we take is essentially from the back of your scalp. And you will have a scar, but the good news about that is that the scar is hidden by your hair. And that hair usually stays. So it's going to be from an area where no one can really make out whether you had a scar or not. All we take is a strip of a centimeter, about 10 centimeters long in some instances, but only a centimeter wide. So that's a narrow wedge of skin from your back. It's not going to leave a gaping hole in your back, and its scar is hardly visible. So, no, from a donor side point of view, one of the good things about a hair transplant is that the donor side is minimally affected. And this is done as a local anesthetic procedure. You do not require to have a general anesthetic for a hair transplant.
Dr. Kannan, just to end off, can women or men have a hair transplant?
Yes, they can. I suppose men are less fortunate than women because they have more extensive areas of bald patches around the front and the vertex. Women usually tend to have hair patches lost around where they part their hair. and those are the areas which become rare over time. But nevertheless, these are areas which are relatively, they still have some hair there, and all you're really trying to do is make it denser. So I suppose in women, better off chances of doing it, a bit of better result, because the amount that needs to be transplanted to make it look natural, it would be significantly less than men.
Thank you, Dr. Kannan. Thank you so much for talking to me today.
You're welcome, Joanne. Thank you.